Today, healthcare workers in New Jersey have 3 days to comply with Governor Phil Murphy's mandate, which requires them to get their first vaccine by January 27th. Governor Murphy doubled down on healthcare workers and anyone who works in high-risk settings by eliminating the weekly testing option.
Yeah, those new requirements could have a drastic impact really on staffing shortages, which have skyrocketed during the recent COVID surge. Things were so bad at University Hospital in Newark that a military medical team was actually sent in by the federal government to help with those staffing issues. Joining us this morning is the president and CEO of University Hospital, Dr. Shereef Elnahal, to talk more about this aid. So good morning to you, doctor. Thanks for being here.
Thanks so much for having me.
So, Dr. Elnahal, military medical teams dispatched to 6 hospitals across the country. Yours was one of them. How big is that team, and how are they actually assisting with some of those staffing shortages that you're seeing?
Well, it's a huge help. 25 people across physicians, nurses, nursing assistants, respiratory therapists, the whole gamut. And they're really every corner of the hospital where we have staffing shortages, day shifts, night shifts. They're already making an incredible impact. And really, they're a major source of morale boost for our staff when we really needed it. We still have about 250 or so employees out due to COVID or a different reason related to COVID. And this has been a huge help already.
Yeah, your medical staff, they were working longer days and took on bigger patient loads to deal with the staffing shortages brought on by the COVID surge. Now, I know you were telling us earlier in the commercial break, if you can explain to our viewers, it's a process, right? I mean, when these medical teams from the military come in, so can you talk about how they started and how long before you really see a difference in their presence?
Well, for sure. We condensed an onboarding process that could take weeks down to less than 48 hours. And these are folks who are used to being deployed, getting their bearings quickly and starting work. And that's exactly what they did. They've already helped across this entire weekend. I oriented them on Thursday and they got started as soon as possible. And so they're used to doing that, these women and men in uniform working alongside our heroes as well.
Yeah, you mentioned 250 of your staff members still out because of some kind of COVID-related issue. But what % of your staff undergoes the weekly testing option, and how will Governor Murphy's new vaccine mandate impact your staffing levels here, right? It seems like every week there's a new change in how you're staffing.
Well, the good news is right now that's a pretty low percentage. Only about 8% of folks get tested weekly, and that's because we also did the full vaccination mandate last summer. So we have over 92% of our folks vaccinated. We're going to get the vast majority of those boosted because really there's no reason for an exemption in the vast majority of cases if you already got your first 2 doses. And so that's the percentage we expect to do weekly testing. And I don't think will actually impact staffing. The fact is we've had bigger staffing problems with people being out due to COVID or reasons related to COVID.
But how long are they actually going to remain there, those medical teams? How long will they actually stay at University Hospital? And when will you say, okay, we're good?
They'll be here for at least 30 days. We have an option to request an extension, but they do tell me that they have a huge demand across the country. And so we'll wait and see if that's needed and if they're able to do that.
Yeah, well, healthcare unions, they're demanding better working conditions after the CDC reduced the isolation guidelines from 10 days to 5 days. So what's your response to their demands?
I think that's a reasonable request. Frankly, the 5-day period is caveated for the general public by the need to mask significantly for the next 5 days. And so we made sure that N95 masks were universally available, even if folks weren't going in and out of patient rooms. Because there's still a chance that folks may be infectious, albeit a low chance, we want to minimize that for our employees. And so I think it's very reasonable for them to ask for safe working conditions, and we have a good relationship with our nursing union.
So you heard right before we introed you, Doctor, some of the numbers that we're seeing in New York and New Jersey, right? Seems like they're on the downward trend. Dr. Fauci has said that the peak has come or is going to come at the beginning of February. So what do these numbers really say to you right now? As you look at them again, these are the New York numbers. We'll throw up the New Jersey ones in a second for you again. But what does this say about what's happening in New Jersey? And is that the story also when you zero in on areas like Newark?
I think we have peaked in both cases and hospitalizations, which is great news. But the caveat here is that because deaths lag, we should expect to see deaths go up over the next week or so at least.
Why?
And so that's not a reflection that things are getting worse with the pandemic. It's just the fact that folks end up getting sicker and take some time, unfortunately, to get to that point. But ultimately, remember that folks are still going to be stressed here. We still have a lot of folks out due to COVID. And of course, the aftermath of COVID with delayed and deferred care, mental and behavioral health issues, we're dealing with all of that in our community, and going forward, we will too.
Yeah, that goes to show we still need to get vaccinated and get those booster shots. Dr. Elnahal, thanks so much for being with us again this morning.
Thank you so much.
Now, Dr. Elnahal, I fractured my. I'm just kidding. We won't get into it. We won't get into it. These people are tired of me talking about it. Thanks, doctor.